A young woman visits the clinic complaining of weight loss despite eating well, constant sweating, anxiety, and racing heartbeat. Another patient has the exact opposite problem: weight gain, tiredness, feeling cold, and all the time, and get dry skin. What tiny organ in the neck could be the responsible for the two completely opposite conditions? The answer is the thyroid gland, one of the smallest but the powerful endocrine gland in the human body. It controls your metabolism, growth, body temperature, heart rate, and even the brain development. In the next 10 minutes, I will explain the thyroid gland from its anatomy to the clinical conditions like hypothyroidism, goiter, Graves' disease, all with the simple diagrams and easy concepts. By the end of this video, you will never forget the thyroid gland again. So let's begin. Thyroid gland is the butterfly shaped gland. It is the endocrine gland and having the rich blood supply situated in the lower part of the front and sides of the neck. Has two lobes. It is like this, two lobes, and right and left lobe joined by the isthmus. Here is the isthmus. Here two lobes joined by the isthmus. Third lobe is pyramidal lobe, may be project upward from isthmus or from one of the lobes. Here is the pyramidal lobe. Sometimes a fibromuscular band or the fibrous band descends from the body of the hyoid bone to the pyramidal lobe, known as the levator glandulae thyroidae. Here is the hyoid bone, and here is the fibrous band descends and joins this pyramidal lobe. This is called as the levator glandulae thyroidae. Functions: regulates basal metabolic rate, stimulates somatic and psychiatric growth, plays role in calcium metabolism. Then situation and extent of the gland: lies against vertebrae C5 to C7 and T1, embracing upper part of the trachea. Each lobe extends from the middle of the thyroid cartilage to fourth or fifth tracheal ring. Isthmus extends from second and fourth tracheal ring. Dimensions of the thyroid gland: each lobe 5 into 2.5 into 2.5 cm, and isthmus is 1.2 cm into 1.2 cm. Weight of the gland is 25 grams and larger in females, and increase in size in pregnancy and during the menstruations. Parts: lobes are conical in shape. Each lobe has apex, base, three surfaces that are lateral, medial, and posterolateral, two borders that are anterior and posterior. Relations of their: apex is related to superior thyroid artery and external laryngeal nerve. Base is related to inferior thyroid artery and recurrent laryngeal nerve. Here you can remember like apex superior and base related to inferior thyroid artery, and apex external laryngeal nerve and base recurrent laryngeal nerve. Lateral surface means the superficial surface is the convex and it's related to these muscles. These muscles you can overlook in the anterior and posterior triangles of neck also, that are the sternohyoid, superior belly of homohyoid, sternohyoid, and anterior border of the sternocleidomastoid. At the last we will see the diagram for the relations. Medial surface is related to two tubes, two muscles, and two nerves. Two tubes are the trachea and esophagus. Two muscles are the inferior constrictor muscle and cricothyroid, and two nerves that are external laryngeal nerve and recurrent laryngeal nerve. Posterolateral surface related to carotid sheath and overlaps common carotid artery. Anterior border is thin and related to anterior branch of the superior thyroid artery. Posterior border is thick and rounded, separates the posterior and medial surfaces. It's related to inferior thyroid artery and anastomosis between posterior branch of the superior and ascending branch of the inferior thyroid arteries. Parathyroid glands are present on the posterior border and the thoracic duct, but only on the left side. Let's talk about this is isthmus. Connects the lower part of the two lobes. Here, two surfaces, anterior and posterior, and two borders, superior and inferior. Here is the diagram. See, this is the hyoid bone. This is the fibrous band connects to pyramidal lobe. This is the pyramidal lobe, that is the levator glandulae thyroidae. It is the thyroid cartilage. It is the middle line, that is true capsule, and it is the cricoid cartilage, pyramidal lobe. It is the lateral lobe. It is the medial lobe. Lateral lobes, not a medial. It is the cricotracheal membrane. Here is the isthmus, and the outer margin is the false capsule. It is a fourth tracheal ring, and these are the In blue color, venous plexuses are present. From the vertebral levels C4, C5 to T1, thyroid gland is present. Next, we will see the arterial supply. The superior thyroid artery, and these are the site of ligation of these arteries. Here is the anterior branch, it is the posterior branch. From the subclavian artery, here is the one branch, that is the inferior thyroid artery. Having these are the branches. This is the inferior laryngeal nerve, and related to that near recurrent laryngeal nerve. It is the inferior laryngeal artery. And near the superior thyroid artery, there is the external laryngeal nerve. These are the anastomosing branch. Next, we will see about the theory, that is the arterial blood supply. First one is by the superior thyroid artery, branch of the external carotid artery. It's run downwards and towards in close relation to external laryngeal nerve. At the upper pole, artery divides into anterior and posterior branches. Anterior branch descends on the anterior border and continues along the upper border of the isthmus and anastomoses with the fellow of the opposite side. Posterior branch descends on the posterior border and anastomoses with the ascending branch and inferior thyroid artery. That's all you have seen in this diagram. Superior thyroid artery, close relation to external laryngeal nerve. This is inferior laryngeal artery, relation with recurrent laryngeal nerve. Then we will see about the venous drainage. Superior thyroid vein emerges at upper pole, accompanies superior thyroid artery, ends in the internal jugular vein. Second one is middle thyroid vein, emerges at middle of the lobe, ends in internal jugular vein. Inferior thyroid vein, that is emerges at lower border of isthmus, ends in the left brachiocephalic vein. And fourth thyroid vein, that is the Goiter vein, may emerge between middle and inferior thyroid veins and drains into internal jugular vein. This is the diagram for venous drainage. These are the brachiocephalic veins, left vein and right vein. Here is the branch for this is Goiter vein. This is the inferior thyroid vein, superior thyroid vein, and middle thyroid vein. Next, we will see about the lymphatic drainage from the upper part of the gland into upper deep cervical lymph nodes, either directly or through prelaryngeal nodes. From the lower part of the gland into lower deep cervical lymph nodes. Nerve supply. Nerves are derived mainly from the middle cervical ganglion and partly from the superior and inferior cervical ganglia. Clinical for the thyroid gland is so important, that is the goiter, swelling of the gland, palpated from the behind. It is the thyroidectomy, that is in the hyperthyroidism case, removal with true capsule. Posterior parts of the gland are the little behind, avoids the risk of removal of parathyroids and post-operative myxedema. Here can be the deficiency of thyroid hormones. During the thyroidectomy, superior thyroid artery is ligated near the gland to save the external laryngeal nerve. Stem of the inferior thyroid artery is not ligated. Its glandular branches ligated separately. In this way, the blood supply to the parathyroid gland is maintained. Next one is the hypothyroidism. Causes cretinism in infants and myxedema in adults. Benign tumors of the gland may displace and even compress neighboring structures such as trachea, causing dyspnea, difficulty in breathing, esophagus causing dysphagia, difficulty in swallowing, and compression of the recurrent laryngeal nerve, that having dysphonia means the hoarseness of the voice. This is the relations of the thyroid gland. This is the thyroid gland. These are the parathyroid glands. Here is the trachea, esophagus. This is the carotid sheath, and this is the common carotid artery, internal jugular vein, and vagus nerve. And here is the recurrent laryngeal nerve. These are the muscles: sternohyoid, sternothyroid, omohyoid of the superior belly of that, and sternocleidomastoid. These are the relations of the thyroid gland. Hence, if you like it, share, like, and subscribe, and thank you. Comment for next topic.